Arkansas Health Department's now confirmed not one, but 2 deaths from the coronavirus. And here is what we know about those 2 victims, according to the health department. One was a 91-year-old man who died at Conway Regional Medical Center. We're told he died this morning around 8.
The coroner tells us that man lived in Higdon in Cleburne County. We know less about the other victim, just that it was a person in their 50s and somewhere in central Arkansas. There are 230 confirmed cases now in the state. We first learned about the second death at today's news conference from the governor.
That's right. Jay Burr was there at the conference. He joins us now with more takeaways from today. Jay?
Yeah, good evening, guys. The governor hitting on several major points today. One of the big ones, though, is that personal protective equipment that the state so desperately needs. And finally, some good news on that front. Governor Asa Hutchinson announcing that early Tuesday morning, the state received 24 pallets of PPE from the national stockpile and included over 27,000 N95 masks. Also, about half of the order that the state put in should be here by the weekend. Now, at the current rate of consumption, this should last the state about 60 days, but Governor Hutchinson is working on bringing more in.
Because the usage rate could accelerate, and there's obviously some people who we're putting a priority on now in terms of our health care workers, but others are desirous of it. And so we want to have as much of a good safety cushion that we can have for our protective equipment.
Also, Governor Hutchinson wants the special session to start this Thursday to enable him some flexibility in fighting COVID-19 and to also fill holes in the budget. Now, the fiscal session is set to begin on April 8th, and the governor currently has no plans of amending that timeline.
It happens to be a constitutional requirement, but I've spoken with the Speaker and the Senate Pro Tem, and so they're taking some extra precautions so that they can have the social distancing that is needed, but they still have an obligation to come together and to get the job done.
And after shutting down beauty and barber shops, tattoo studios, nail salons, and massage therapists yesterday and already limiting restaurants to what they can do, the governor says he's been asked about why not shut down the whole state and put a shelter in place to curb the spread of COVID-19.
I believe we're approaching it in the right way, which is being very specific under Dr. Smith's leadership of giving a directive as to who should be open, who should not be, concentrating on that face-to-face or person-to-person mission.
And also at today's press conference, Dr. Nate Smith bringing up the topic of funerals. And he says that while he does understand people wanting to pay their respects to loved ones, he did say to limit those as much as possible and to possibly schedule memorial services at a later date. From the Department of Health, Jay Burr, KRK 4 News.